My name is Linda Snetzelaar, and I am editor of the Journal of the Academy of Nutrition and Dietetics. And today we are highlighting an article that will be appearing in the May issue of the Journal of the Academy of Nutrition and Dietetics. And that article is titled Structural Barriers Influencing Food Insecurity, Malnutrition, and Health Among Latinas during and after COVID-19. And I'm honored today to have with me Dr. Payan, who is going to be talking about this particular article. And as you will note, the title of the podcast today is Food Insecurity, Nutrition, and Latinas, Insights During and Beyond COVID-19. And I want to tell you just a little bit about the author of this article who's with us today. She is an assistant professor of public health at the University of California, Merced, and she leads the Community Health and Innovative Policy Lab. This is a lab that conducts applied public health and health services research, promoting equitable and community-oriented policy solutions. And additionally, her particular research topics focus on nutrition-related health disparities. What I would like to do today is just begin by asking a few questions that I think are very important to summarizing some of the things in the article, but also getting some very important ideas from you, Denise, relative to the work that you're doing. So we'll begin with the first question. How has COVID-19 contributed to rapid increases in food insecurity levels that we're certainly seeing today?
So thank you for having me on to talk about this really important issue. During the pandemic, there's been, I think what's broad kind of well known now is there's really high rates of food insecurity in the United States and just globally. The impacts of COVID-19, specifically the responses to COVID-19, and then people who are most vulnerable to malnutrition and were most vulnerable before the pandemic are being disproportionately impacted. Um, so there's economic pathways, but then it's also important to highlight how some of the shelter in place orders, school closures, these have also led to social impacts and kind of, added costs for families. So we can think about, school closures, schools being a primary source of food for one or even two meals for some households, particularly Latino and Black households in the United States. And so this was a source of access to nutritious food that was disrupted by the pandemic, and it's been ongoing. And so other sources of emergency food resources, like food pantries, which are really critical lifelines, they've also had to modify how they distribute food to do so safely. And now there's excess demand, and so some of our emergency food resources are really doing their best and have been doing their best to try to address these really high levels of food insecurity, often in communities that already had lower resources. And so, you see a lot of these resources and safety net programs are being overwhelmed by this increase.
Your commentary focuses on food insecurity and malnutrition, specifically among Latinas in the US. And I was wondering if you could tell me what the basis for focusing on this particular group is.
I'm actually involved in a couple of COVID-19 studies that focus on the economic and social impacts of COVID-19 policies on Latinos, including farm workers. And one of the things, so these are remote interviews that we've been conducting since last summer. And, some of the things that have arisen are just this extreme vulnerability for Latinas within their households. So this was already a group that had a higher wage gap before the pandemic. This group is leaving the workforce at really high levels. In many cases, it's not a choice because during the pandemic, but rather this decision, especially for mothers, to work, not being able to work from home, and take care of their children. And so some of the economic indicators for this group have been really concerning. And so in the household kind of environment and going back to the interviews, we're just seeing that within the household, decisions around food, food acquisition, they're often the person who's accessing food and bringing it into their household and preparing it. But the disproportionate impact on their mental health and behavioral health and well-being is affecting how the food that they access and whether it's healthy or not and can support um, an active life, kind of thinking about food insecurity. And so these are all kinds of the things we wanted to elevate and think about in the commentary and propose, thinking long-term beyond the pandemic. So very important to think about extremely vulnerable populations right now during the pandemic and what can be done, but also moving forward, the really high rates of concern around malnutrition, mental health, and how these things interact for certain populations. So Latinas, were really something that through the work that I was doing, people I was collaborating with, we thought maybe a commentary to highlight kind of a research agenda, but more importantly, what can be done in practice now and in the future for this group to promote equity was what we started working on this last summer to think about it.
Yes, I think environment is so important. And I guess when I think of the environment, I think of where someone lives, but also what's going on in their home life, and then also what's going on in the community. And then, as you have already indicated, that access to healthy foods. And I was wondering, how does the environment play a role in that concept of food security? Could you delve into that just a little bit more deeply?
Sure. So some of the work I was previously in Los Angeles, and I focused on South Los Angeles and East LA. So some of my published work focuses on the food environment and health behavior decisions, including diet and physical activity uh, behaviors, how they're impacted by food environments and also policies. So I'm a health policy researcher who has been really interested in policy shaping environments and decisions. And so for nutrition policy, thinking about the impact of nutrition policy, but on availability and convenience and really important factors for folks to access food. And so during the pandemic, that's changed. People were already, so Latinas were already disproportionately living in food environments that were not supporting their nutrition, the best nutritional outcome for themselves. And then with the pandemic, people were spending more time in their home and in their community environments. And I think that's something that has kind of yet to play out, and research is needed to think about people spending more time in communities that were not supporting nutritional outcomes or didn't or had less resources, including healthcare resources. Um, and so the community kind of food environment, there's different aspects to it. It's not only the availability of food retailers, but there's also other types of more temporary kind of like mobile vendors that come into that space. And then you can also think about marketing. And so one of the co-authors, Susana Ramirez, focuses on health communications and really brought that stronger piece related to the communication environment and its impact on dietary decision making. And so before the pandemic, this was already something that other researchers have been demonstrating that Latinos just, they live in communities that have higher rates of marketing of unhealthy food items like junk foods or soda in their school and their community environments. And so these are all the types of things that we're making decisions about the food that we're purchasing based on access to it, but taking in all of the marketing that's available to us in different sources. And now we also have it on the internet, and we're spending a lot more time on screens. And so there's a piece in the commentary as well about, this kind of increased exposure to marketing of unhealthy foods as well that could have been happening during this time. So these are all kind of the different things in our environment. There's also who we have access to in terms of, there's a nutrition education component as well, those being really critical resources that can help kind of, thinking about dietary behavior and decisions and the preparation of food.
Yes, so important. How has nutrition policy, especially in relationship to the environment, changed since the pandemic? And then what are some things that still probably need to be done to address existing needs?
So in the United States, we have several large nutrition assistance programs, the largest being the SNAP program. Here in California, it's called CalFresh. And so this really is a program that is supposed to address this issue of food insecurity and alleviate food insecurity for low-income households. And then we have other programs, including WIC, that are more targeted in their focus. And so these programs are really can influence food access, utilization, and also influence, where people shop in their communities, if that's the source of benefit source that they have access to. And so during the pandemic, these programs have changed. There's been a lot of dynamic, some slow going also. Policy is slow, but even during the pandemic, there's been kind of modifications to kind of address rising rates of food insecurity. And then the other aspect during the pandemic is ensure safer distribution of resources. So for some of these programs, how people access their benefits or can use their benefits safely has been an important aspect. And so last year, we saw the 116th Congress enact multiple policies to expand access, especially in the early months in March. And so you had, increased SNAP benefits. You had, we had some stimulus funding. So because of the role of economic insecurity, the stimulus funds could also help alleviate food insecurity, but there's been very limited support compared to other countries in terms of economic stimulus, and providing people that economic benefit to address some of their basic needs. And then you've had the SNAP program, but also the USDA has made modifications for the school lunch program. So going back to that providing a source of really critical access for families with children, and with the USDA's changes, some of the modifications have included what now a lot of people know is PEBT or pandemic EBT. But some of the challenges, what still needs to happen, there's been limited access to some of these additional resources. Some of the modifications, like SNAP has now allowed online purchasing, using the benefits online as opposed to only in person, but even now there's very limited use of using the benefits online for a variety of reasons. And so now we're in the implementation issues. And some of those are still yet to be examined or closely investigated. And so even though there were modifications, we don't have a great sense of who accessed these modifications, who was able to do so, and able to do it over time, and who was left out. And so going back to the issue, for Latinos, I'm really interested in thinking about immigrant Latinos, people with limited English proficiency, and how other aspects, so even not nutrition policy only, but thinking about other policies, how other policies could have deterred certain groups from accessing these programs. Or even kind of the lack of knowledge about their eligibility or the modifications. There's a big gap in what happens in the policy world and what people are aware of, and that certainly impacts utilization.
Yes, so true. I think too, understanding policy should be a very important part of actually making policy. So, very, very important comment. And then my last question, how can researchers and nutritional professionals address gaps in research and practice so that we're promoting a more equitable response to these issues that you have brought up?
So I think in terms of, the commentary has a piece on how policies can actually intersect. So not only thinking about nutrition policy, but how there are other policy domains and other policies that are being developed and implemented that also impact these decisions to use SNAP, to enroll in SNAP, even if you're eligible. And so one of the key points of the article is to highlight, for instance, during this time, public charge, immigration policy, immigration enforcement, these decisions also have impacted immigrant communities, and Latinos have very high rates of immigrant populations. And so because of that, we want to highlight that these other policies can impact, and even if the recommendation someone's eligible or a household is eligible for SNAP benefits, they may be worried, concerned, and ultimately not enroll. And so that's in the SNAP program, there are lower levels of enrollment for Latino households, and a couple of studies have come out in the last few years that show that Latino households and Latinas have also kind of demonstrated concern and are shying away from enrolling even when their household is eligible for some of these critical programs that provide nutrition assistance. And that also impacts access to healthcare services through the Medicaid program, and even access to resources that are publicly available through community resources if those community resources or sites are not trusted. If you don't trust where the nutrition assistance or the food pantry is based. And so we want to highlight that the recommendations that are being made to address food insecurity should also take into account and consideration these other policy effects in the broader kind of context for people and groups. I think the other aspects, thinking about offsetting food insecurity should be a key goal that we continue, but there should also be this piece of thinking about how our interventions that address food insecurity, they should also be thinking about malnutrition. And nutrition professionals are wonderful at this part. They're really a key part of the puzzle. I actually think on the policy side, we need to more explicitly think about how some of these programs are also addressing malnutrition and risk factors for chronic disease. And so, some of the things that or some of the recommendations that I think can help. I'm a researcher, so I think about the research that could support evidence-based policy decisions. So with regard to COVID-19, thinking about implementation research, going back to that issue, is who benefited from these policy modifications. So who was using the SNAP benefits online, who had access to this. And so figuring out what some of the problems are, and kind of quickly, so rapid implementation research can help address some of these issues. And also asking the users and going to the source is also really important to figure out what, in the future, we have another emergency or another pandemic, how can we do this more effectively and efficiently for all people? And so on the healthcare side, I think, some of the gaps are starting to see these really innovative interventions that are community clinical linkages. So I think on both the research and the professional side, supporting interventions, testing them out, and then scaling the effective interventions that try to address both this issue of food insecurity through screening for food insecurity and referring food insecurity clients to different food, community food resources and nutrition education programs. Figuring out these models, especially in lower income communities or communities with, even thinking about language access, so communities with immigrant populations, can be really, really helpful to kind of address the longer term issue and the dual issues of food insecurity and malnutrition for folks and for Latinas.
Thank you so very much. I think all of the points that you're making are so important to ways in which we can move forward with new policies, but also move forward with some of the understanding that has come through COVID, and COVID being something that we were forced to deal with, and probably in many cases weren't necessarily prepared to deal with. But your thoughts and your ideas here are very important, and I'm hoping that many will go to the article that you published in our May issue because it provides, I think, a lot of very thoughtful ways for us to look at food insecurity along with malnutrition and then in general health. So thank you so very much for presenting today. And I know that this particular topic is one that many are interested in and concerned about today.
Thank you for the opportunity.